And then the conference ended. But people didn't walk away from that conference and say, did a good conference, on to the next issue. No, they said we have to build a Canadian healthcare coalition. We have to build it at the national level. We have to have national organizations engaged, and we have to build provincial health coalitions and territorial health coalitions to put people on the ground and put into practice what we're pushing for. And so that happened. There was leadership and there was commitment, and so we've been around for 30 years. And along the way, there were some really interesting milestones. Justice Emmett Hall did a second health services review in 1980. In 1981, I remember the Parliamentary Task Force on Federal-Provincial Fiscal Arrangements. We have the established programs financing, replacing 50-50 cost sharing for healthcare in Canada. And then there was, after the SOS Medicare conference in '79, there was, in the spring of '81 to the winter of '83, there was a Save Medicare campaign that addressed the erosion in Medicare, and there was a petition drive. And we collected 63,000 signatures. And remember, that was before the days of online petitions. So it was taking that petition out and getting individual signatures. 1984, unanimous passage. Not too often that happens in the House of Commons, of the Canada Health Act. It was an achievement, not perfect, but it didn't take too long before we realized that the act wasn't any good unless there was going to be full enforcement of it. And the annual report that the health minister is to make on the enforcement and what was happening under the Canada Health Act put in place the need for doing something to make sure that that Canada Health Act was enforced. And interestingly, in September of 2004, after 2 years of work by a number of national organizations that included the Canadian Health Coalition, but certainly with leadership on the part of the Canadian Union of Public Employees, we had a ruling from a federal court that said that the Minister of Health's failure to monitor, enforce, and report on the Canada Health Act raised important public policy questions which should be taken up in Parliament. They took it out of the court and handed it back to Parliament. The decision didn't reject our application. It rejected our application, yes, but it didn't dismiss the arguments. And the decision was put squarely back in government and politicians' hands. And so we continue with our efforts to achieve accurate reporting and enforcement on an ongoing basis, because there are still huge amounts of information that isn't reported in that Canada Health Act, and it should, especially the reporting on what is spent on for-profit healthcare delivery. Yes, we intervened in the Shauli case in Quebec. Long, tedious process, and we were there. And not everybody heard this, but the BC Health Coalition has had a success, as did Canadian Doctors for Medicare today, because in BC there's a federal court ruling that there will be, the BC Health Coalition and Canadian Doctors for Medicare will be given intervenor status in the court case involving Dr. Brian Day and his private for-profit surgical clinic, and the government of BC will send the auditors in to audit the books of the Day for-profit clinic. We come to the drug issue, and there's all kinds of pieces of the drug issue, but the Canadian Health Coalition was involved in the Eastman Commission, which was a commission looking at the pharmaceutical industry and issues around patent protection and compulsory licensure. And we were there when Bill C-91 and then Bill C-22, drug legislation that extended patent protection and made compulsory licensing just not as available and easy to achieve for the generic companies. We were also in the courts over direct-to-consumer advertising. And if, I guess, CanWest Media Works wasn't in such a financial difficulty, we'd still be waiting for the decision on that court case, but it was dropped. But I think it'll probably be back. You know, we were there during the time of the National Forum on Health. We didn't hold out a lot of hope at the beginning of that process, but we worked with the people that were the commissioners in that process. And then we were there in force at the conferences that were organized around the country to talk about pharmaceuticals in Saskatchewan, electronic and technology in Edmonton. Remember, many of us in the east ended up going to Rochester because of the fog in Toronto. And that was an interesting night. And a conference on home care in Halifax, where we really felt there was a momentum in this country to achieve home care. And then the political powers didn't share that vision. We've been there on issues related to food and drug safety. Justice Creever and the Creever inquiry into the tainted blood, about mad cow disease, bovine growth hormone in the milk, genetically modified food, listeriosis. Those are real issues, and it's all based in the need and desire by government to deregulate and to privatize. It's all part of that picture. And then came the Romanow Commission and 18 months of mobilization so that we truly as organizations would sing from the same song sheet and deliver common messages as Commissioner Romanow heard the testimony of Canadians across the country. And by the end, we had Roy asking, show me the evidence. Show me the evidence that for-profit, privatized health care will be cheaper, will provide higher quality, will not compromise public services. And the silence and the lack of evidence was deafening. We got those messages out. We didn't get everything we wanted in the Commissioner's final report, and we didn't get enactment of the kind of changes that he was proposing. And then, of course, there was the NAFTA, and first of all, the Canada-US trade agreement struggle, then the NAFTA piece, and working to make sure that Medicare and any of the programs that would be added to Medicare would be protected from international trade obligations, that our system could be protected. So in the last 30 years, I've spent a lot of time in committee rooms, outside in the cold and the wet and the sweltering heat, as we've been there watchdogging what premiers and federal, provincial, territorial health ministers and the Prime Minister have been doing and talking about. And it's been interesting, fascinating, and compelling work. Probably one of the highlights for me, though, was the conference in 2007 in Regina, when we had SOS Medicare 2. 650 people from across this country came together. We heard international speakers and looked at healthcare funding issues, discussed the need to provide national pharmacare, home support, and long-term care, primary care, and pay attention to things like prevention and the determinants of health. And so, at the end of this, when I sat down, I was exhausted last night by the time I'd written out the list and think, no wonder we're tired, no wonder my hair is gray. But what have we achieved, I guess, is the question we ask. And I believe that in the end, it's the results of things like Nick Nannis's most recent poll, and Mary made reference to it, I round it off and say 90% of Canadians believe in universal public health care. And that's despite the millions of dollars spent by those with extremely deep pockets who do not share our vision of what health care in this country should look like. I believe we do it because we believe in our values. We believe in caring for and about each other when we are well, so at a time of illness, we will not have to worry how much money we have in our